They don't know you from Adam, and you're a new entity to them, and they don't know if they're safe or whatever. And so but there are those positives. So one of my patients I've been taking care of since they were born just came out to me as trans and said, how do I get care? And it was wonderful to work with the family that I've worked for 20 years,
right,
with this individual, and they felt comfortable enough to ask me that, which was, for a physician, for a provider, I'm sure Dr. Alto feels the same thing. For a provider to have that kind of confidence in them is always fine. It's always good. It makes your heart swell. That good. I'm doing right by this patient.
Right. Well, we talked about the comfortability of it and the whole nine, but one of the things that Dr. McLoney said previously, just working with the youth and you seeing their kind of, their openness and their willingness to just be a healthcare professional, learn how to be a healthcare professional for everybody, regardless of anything. Hopefully this starts to kind of turn the tide on some of these, inappropriate, basically, interactions that doctors are having with patients, especially new patients, when they are trying to, as you stated, steer the conversation towards one thing or focus on one thing instead of just being open and listening. So hopefully we can start to see the things change a little bit moving forward.
Yeah, and there just can be little changes of, I think we've mentioned some solutions already, but it's just little changes like putting people's pronouns in our medical chart, right? So that's something that we're able to do. Everybody who opens the medical chart is going to be able to see the patient's preferred name and their pronouns. And that's something that was unheard of and unthought of, not that long ago, but that you deserve to go into your healthcare system and have people refer to you correctly.
Exactly.
Use your name, use your pronoun. That shouldn't be this special thing that only happens with some doctors in some places if you're lucky. That's kind of it should be a bare minimum. And I think those are the things that are changing. And I see a lot of hope among the young patients as well. Because working with the lifespan, I talk to trans people in particular in their 70s who did not have access to any of this in terms of transition, and working with healthcare providers around medical and social transition when they were young. And I also, talk to 19-year-olds. And there's a big difference, and you can really see the difference in mental health outcomes for people who are able to be authentic and get the care that they need when they are younger versus people who had to wait decades to get it, which makes me feel hopeful about the future for sure.
And it's, as you said, small things. So like my name badge, I have my pronouns on my name badge. And in my regular clinic in Middleburg Heights, I often get a lot of questions. And in fact, just recently I had a patient say, I'm really uncomfortable with that. I'm like, let me explain it. We talked about it, the reason why it's so important. They were old enough to remember John F. Kennedy. So I'm like, remember he went by Jack? That wasn't his name. He liked Jack instead of John. And it's just respecting a person what they wish. And they're like, oh, that makes more sense then. So those little things that we can educate patients on, even if they're not part of the community, just so they're more aware. And as an old white guy, when I was in medical school, the vast majority of my class was white. We had, I think, 50% women, which was rather unheard of back then in the late 80s. But, the classes that I'm working with at Case now, it's like every color, every gender, every
beautiful
orientation. It's really nice that they're really getting all these people in and they're sharing their stories. And
that kind of alludes to something I was thinking. It's as I keep kind of putting the onus on the doctors, but it's really kind of like a society thing too, right? I mean, it's we all need to just do better as humans and as people, in terms of learning and being more aware, but also just being sensitive to what people want and what people are requesting with their own being. So it's from the top down. We can all do a little bit better, but we'll get everybody out of here. Go ahead.
Yeah. No, go ahead. We completely agree with you that state and federal, things need to happen at the state and federal level, at education level, systems need to change so that individuals can change within them to all provide better care.
For sure.
It's really interesting because the question I keep missing every year on part of the studies and things we have to do for Metro is patients want to be treated not as you would want to be treated, but as how they would want to be treated.
Exactly.
Which is an extension of that. And you're absolutely right. And what Dr. Alto just said, a lot of these laws and everything, even though they don't directly affect my patients are affected by them. They're very worried and concerned, and it's just feeding into this distrust of society and healthcare in general. And I'm glad that we can provide a safe space for them so they can still get their healthcare. But a lot of them, come in and they burst into tears and they say, I don't know what to do because the world is so terrible and blah, blah, blah. And it's like, keep going forward, and hopefully we'll come out of this tunnel soon and things will be all better. And I always tell them about the kids I'm working with the case. The future of medicine's bright, so hang in there. It's coming.
Yeah, you guys are definitely fighting the good fight and doing the good work, and we appreciate you. So, Dr. Alto, we'll swing back to you, take the lead on this last one, and we've kind of touched on it, but you can feel free to dive as deep as you like on this one. Okay. What solutions does MetroHealth provide? The ultimate question, right?
Yeah, absolutely. And I think that, like we've talked about, that there are different levels of solutions, right? So we want to look at some of these big picture solutions that go far beyond MetroHealth, looking at our community and our country and our state as a whole, policies about preventing poverty and helping with housing, healthcare, laws against discrimination. Those are all kind of big picture solutions that MetroHealth can be a part of, but that are bigger than MetroHealth. I think solutions at MetroHealth, like thinking about training the next generation of doctors, which we've touched on several times, and thinking about how this is not, my dream is that this won't be a specialty care in the future.
Yes.
Is that this will be healthcare. It is specialty care right now because healthcare has failed to include it as part of foundational competencies. But in the future, that everybody will know how to care for this population because they are part of our community, and deserve access to the same type of affirming and respectful care that we all do. So I think that when we define what we call competence in the research, it's broken down into knowledge, skills, and awareness. And I think we're working on all of those. So for the next generation of doctors, but also for our current generation of healthcare providers, but also through anyone who comes into contact with us, both at MetroHealth and outside of MetroHealth. Like, we're going to be at Pride tomorrow, and we're going to be talking about these things too. Because if we all have more knowledge, skills, and awareness about how to work with this population, then that's really the only way forward. So that looks like conversations, casual ones. It looks like official trainings. It looks like this, what we're doing right now, to increase awareness about this population and their needs. So those are the solutions that we're looking at. And we briefly alluded to this, but I think it's a really important one. All the research shows that some of the best ways to provide care to marginalized populations is for that care to be provided by people from those populations. So we need more LGBT doctors. We need to be making medical education accessible for them, so that we can have care from people who are, caring for your own community is really important. So I think that's part of the process too.
Yeah.
I know before you go, Dr. McLoney, I apologize. This is why all of my mentors told me to write everything down. I was supposed to lead to you with this final question. So you go ahead and bring us home.
So I was just going to say something that Dr. Alto was alluding to. It is very much being out there, being aware, being open. I know it's a scary time for everybody to show their pride. I never thought this would be the case after we've gone through the last 30 some years, 50 years really, of doing this, that we would be back kind of to square one. But it's very important. I think it's much harder to not understand someone if you've never met someone in that population. It's harder, I have patients now that, oh yeah, my nephew is trans or my niece is lesbian, and they understand it because they have exposure. I think the exposure really can't be emphasized enough. And yeah, we are getting, one of my classes in the last few years has had 2 openly homosexual or gay people in it. They're being trained and they have that little bit of awareness in the area. And just so wholeheartedly agree with Dr. Alto. I'm hoping someday this will just become care. Because
Exactly.
it is just healthcare, but there's a need for the clinics right now because of the fact that they have been ignored and overlooked for so many years.
So this was a great conversation. I think my daughter's ready for me to wrap it up because she's frying bacon in the kitchen right now.
And I know we definitely
break.
went longer than planned, but that's
Perfectly
what you get
fine.
when you ask people who are passionate about it.
Absolutely. And we have more than one guest, and we needed to provide everybody with enough speaking time. And I don't think you guys get paid by the hour anymore. I don't get paid by the hour anymore. So it's all good. But this was a really good conversation. The one thing that I meant to point out much earlier than this, anyone watching, any of our listeners, viewers, if this conversation touched you, or if you feel like it needs to be passed on to someone that you know, someone that you love, please share the video with them. It's going to be on the internet forever, as everything on the internet is. So please provide this video to them. And then, of course, we'll have this information down in the caption below. But to reach the department through MetroHealth, it's just metrohealth.org/pride. And then if you want to make an appointment, the phone number is 216-957-4906. And then Dr. McLoney, as you stated earlier, it's not just one central location. You guys are spread out through the Cleveland MetroHealths, all of them pretty much, right?
Correct. And just a correction, you said 4906, it's 4905.
Oh, I'm sorry. I misprinted that. So,
but yeah,
216-957-4905. Thank you for that.
Perfect, good. And yes, and we've got clinics all over the city, so hopefully they're convenient for people that live anywhere. And we've just got phenomenal providers. They're all very good. And we've got great behavioral support too that oh my gosh, Dr. Alto has added so much to our group.
Yeah,
so, yeah.
and we're growing. We've been growing our team too of behavioral health providers, and we also have some great referral networks as well to make sure that we can help people, whether it's inside MetroHealth or outside MetroHealth. We want to make sure that everybody gets the care that they need, and we will see everybody at Pride tomorrow as well.
Absolutely. As before we close, I know we've talked, but I just like to give everybody an opportunity. If there's anything that we missed, if there's anything that you want to touch on, just harp on one more time. This is your chance before we get out of here. Anything did we cover all the bases?
I think you did, and I really appreciate you saying share this video with anybody that needs care, because we're here to give you the care that you need. We have a great Pride coordinator in the name of Ginger Marshall that will really help out if you have issues. She'll be at Pride tomorrow, so stop by the table on Mall B, downtown Cleveland, and we'll be there and we can talk to you and give you more information.
Perfect. Well, as I say with everyone, Dr. Alto, I don't want to cut you off. Did you have anything?
No, I think that we did a great job of kind of covering all that, and I'm sure we could talk for hours about it. So you have to cut us off at some point.
Yeah,
and and that's with all of these conversations. There's always so much more we can talk about, right? And as I say with everybody else, I'm sure we'll have more conversations in the future. At least I hope we do, because we all got Alan, our producer, is probably tired of hearing me say this. He probably thinks I just say it, but I literally learn something every time I have any of these conversations with anyone at Metro. You guys are so great. And I'll just say this real quick before we get out of here. I didn't have a primary care doctor for quite some time, and my wife was harping on me for that for quite some time as well. But once we started rolling these conversations with Metro, I literally called Metro. I live in South Euclid, and my doctor is at the Cleveland Heights location. So you guys do great work, and we appreciate you so much. So thanks for your time. We'll talk soon. And we really appreciate everything that you've contributed. So thank you.
Thank you. Congrats on getting a primary care doctor. That can be our tagline for the show. Everybody get a primary care doctor.
It's so important. It's so
It
important.
It is.
Yes. And as Dr. McLoney said, happy Pride Month. And we'll talk soon, guys.
Sounds good.
Bye. Thank you.
Bye-bye.